Okay. Next question. A man continuously using decongestant nasal drops for a very longer period of time. What can be possible adverse effect? So the patient is using decongestant nasal drop like the Otrivin drop, Xylonis drop or some other clinically approved nasal drops are there. Usually we prescribe these drops for 5 days to 7 days, but if patient uses this continuously, what happens? Firstly, try to understand what is the term. What happens whenever you use the nasal decongestant drop, it will causes the vasoconstriction that will leads to ischemia. Suppose patient is using it for longer duration, so the ischemia will persist, that will lead to counter effect of vasodilatation so that the ischemic changes can be reversed. So what the body do to overcome that ischemia caused by continuous use of decongestant nasal drops, the patient, the body will respond by doing the vasodilatation. So again there will be boggy or this nasal droppage will get exaggerated. So again patient will use nasal drop more, so that a cycle will begin. So what that will cause? That will cause a adverse effect is known as rhinitis medicamentosa. That means if we use the medicine for longer duration, that will lead to continuous rhinitis. It is a correct answer. We will discuss about other options also. First, try to understand what is rhinitis medicamentosa. That is use of nasal decongestant more than 1 week will leads to vasoconstriction, ischemia leading to excessive dilatation as a compensatory response, and that will lead to more and more use of decongestant drops by the patient. That will leads to addiction. So what will happen because of that? The mucosa will get permanently edematous, that will not get reversed by further use of the drop. So patient will not feel any benefit by using the drops in a longer duration, and this nasal blockage will become more or less permanent. So how we can treat this? First is to stop using the decongestant nasal drops. And then what we can use? We can use the steroidal sprays like the fluticasone. So we will use the local steroid. If that is not helpful, then we will go for the systemic steroids. Okay, so that's how we can control the symptoms of rhinitis medicamentosa. Now let's discuss about vasomotor rhinitis, allergic rhinitis. What is vasomotor rhinitis and what is allergic rhinitis? Allergic rhinitis is a type 1 hypersensitivity response. What happens in that? The IgE level will get increased, that will lead to further allergy. It is a type 1 hypersensitivity reaction that will lead to pale boggy nasal mucosa. Look at the picture. This is a picture showing inferior turbinate where the turbinate mucosa seems to be pale boggy. Okay, this has been asked in the exam. Okay, so in allergic rhinitis, it is a type 1 hypersensitivity reaction with an elevated IgE level and mucosa become pale or boggy. How we can treat? We can use the antihistaminic, we can use the local steroidal sprays and decongestant drop, but for the shorter duration. What are the special signs in allergic rhinitis? There are 3 types of signs. This has been asked in the exam. One is the allergic shiner. There will be some shining appearance below the eyes and there will be some puffy folds. Demarcation will occur just below the eyes, which is known as Denny Morgan folds. Okay, so that will happen in a chronic allergic patient. And the third sign is allergic salute. See, patient of the nasal allergy will again and again do this movement. He will use the handkerchief and clean again. So what will happen? Because of this continuous movement, this upper cartilage in line will be drawn here, which is known as allergic salute. A bony crease will appear here over the dorsum of the nose, which is known as allergic salute. So these are certain signs which are present in a chronic allergic rhinitis patient. Now what I mean by vasomotor rhinitis? It is an increased parasympathetic tone. Increase parasympathetic activity in any of the patient. In nose, what is a parasympathetic nerve? That is median nerve. Median nerve. So overactivity of the median nerve will lead to vasomotor rhinitis, where my nasal mucosa or turbinate will look edematous but congested. They will not be pale, they will be congested mucosa, hypertrophy of the turbinate. In this condition, IgE will be normal, it will not get increased. What is the treatment? Again, steroid spray, decongestant treatment. If suppose medical treatment is not helping, we can go for the Vidian neurectomy, that is to cut down the Vidian nerve.